A very good evening, everyone. With me, I have three very important persons, and a dearth of medical knowledge resides in each of them. With me, I have Dr. Nirmalya Roychowdhury, Senior Consultant Medicine. With me, I have Dr. Pushpita Mandal, Senior Consultant Medicine, and we have the Director of Medicine, Dr. Biswajit Ghoshdastidar. Welcome you all to this very popular show. Today's topic is vector-borne disease. Now, my first question to Dr. Nirmalya Roychowdhury. So, what is the worldwide impact of the vector-borne disease and its Indian perspective?
So let's first explain what is vector-borne disease. Vector-borne disease is a kind of disease or a group of diseases where the transmission is not from an infected individual to another. You need a vector. In most cases, say mosquito is a good example. So if I have dengue, I cannot give dengue to someone else unless a mosquito bites me and carries the virus with it to another person whom it infects by biting. So that is a vector-borne disease. What are the good examples of vector-borne diseases? Dengue fever, Zika virus infection, West Nile virus, Japanese encephalitis, malaria. These are common vector-borne diseases. All of them are not common everywhere in the world. So for the Indian perspective is concerned, we would be particularly focused on dengue and malaria. Dengue is the commonest vector-borne disease in the world. Out of 8.5 billion people in the world, about 4 billion, that's almost half of the world population, lives in dengue endemic areas. So dengue is the most important vector-borne disease of the world. And malaria is also equally important, particularly given the high mortality secondary to malaria. So for Indian perspective is concerned, we should focus on dengue and malaria, but also certain other vector-borne diseases like Japanese encephalitis is also important in certain areas in India where they are endemic. And with that, I will answer Dr. Basu's question.
Right. So now to sir, dengue is so prevalent in our country. What is the mode of transmission, as he said, Dr. Nirmalya Roychowdhury said it's a vector-borne disease, and what are the common symptoms of dengue and how to differentiate with other common febrile illness?
Yes, it is a very good question. Well, as Dr. Roychowdhury said, that it is a vector-borne disease and the vector is a mosquito. Now, what mosquito? So now it is there are different species of mosquito we know. Aedes aegypti is a kind of mosquito that actually carries the dengue virus, and the transmission is through the Aedes aegypti mosquito from human to human through the bites of the mosquito. So that is the mode of transmission of the dengue viruses. And you are asking about the common symptoms. As we all know, fever is the most common symptom. Characteristically, it comes very suddenly. It's not that a few days of mild malaise and fever like we have in influenza and other kinds of diseases. It's very sudden onset and often associated with headache. And the headache can be quite bad, quite splitting headache. There is one particular type of pain that's called the retroorbital pain behind the eyes, which is also fairly characteristics of the dengue. Body ache and joint pain is also, it can be so severe that one of the terms of the dengue, the description of the dengue is a break bone fever. It's as if your bones are breaking, that kind of. And the fever often has a characteristics of that it subsides by the third day, and then it remains without any fever for a day or two, and then the fever rises again. So this is called a saddleback kind of distribution of the fever. This is also something, if it happens, it is fairly characteristics of the dengue fever. Generally, some skin rashes may appear, and those skin rashes may or may not be associated with low platelet counts, but the skin rashes appear when the patient has a remission of the fever. During that time, the fever appears, so the skin rashes appear. Most skin rashes are fairly benign. It's an itchy skin rash. It goes on its own. But some skin rashes can be associated with a severe form of the dengue. It's called the hemorrhagic rashes, and one has to be very careful when somebody identifies that as a rashes. So these are broadly the signs and symptoms of the dengue. And so absence of respiratory symptoms rules out, the usual respiratory influenza kind of illnesses. Typical shivering, which is often a characteristic of malaria, is absent. Some shivering is there, but the malarial shivering is quite different. It's very severe and with rigor. It is generally not that bad in dengue. So these are the differentiating fevers, absence of urinary symptoms, etc.
Sir, low platelets, as we all know, this is a common concern to people as well, those who are having dengue. How much is it of concern, or is it only the low platelets, or the PCV and hemoglobin also matters?
I think this is the most important question, that the message that I should convey to everyone is that the low platelets is a very common association with dengue fever, whether it's mild or moderate or severe, and it actually can happen in other viral infections as well. It is not a very specific about dengue, but certainly dengue is very strongly associated with the low platelet count. But at about 95 out of 100 cases of dengue, the platelet drops, and then at some point of time it rises again, without causing any problem at all. And this is a very, very common association of dengue. But unfortunately, we are very scared about these platelet counts. We are very scared about the platelet counts, and we forget about everything, but we focus on the platelets. But let me tell you, the actual problem with the dengue virus, where the complication arises, is due to the certain changes that happens in the capillaries, the small vessels in the body, which becomes very leaky, and the fluid portion of the blood, they leaks out of the capillary and causes the blood becomes very thick inside the vessels. The blood that flows becomes very thick and viscous, and that thick blood can actually clog the small arteries in the vital organs, and then can cause catastrophic functional impairment of those organs, which includes kidney, lung, heart, brain, everywhere. This is a dangerous forms of dengue, which is a severe dengue or dengue hemorrhagic fever or dengue shock syndrome, but they are extremely rare, let me tell you. But there also the platelet might drop, but the drop in the platelet is certainly not the cause of that severity of the dengue. So it is very, very important for everyone to know that the drop in the platelets is not the issue. Issue is how thick is your blood. And our duty as physicians is to improve the fluidity of your blood, so that we can constantly deliver fluids into your body, whether it is through the mouth in the mild cases, and certain cases when the patient cannot take enough fluids through the mouth due to their symptoms like nausea and other things. You have to deliver the fluid through the vein intravenously. That is a very fundamental treatment of dengue. The first 3 days of dengue fever, we have a calculation from the height of the patient and the ideal body of the patient. There's a very simple and nice calculation. And with that calculation, we can easily calculate that how much fluid that particular individual requires in the first couple of days. And if that requirement is fulfilled, either through the mouth or mouth as well as IV or only IV, whatever with the distribution, and that is the mainstay of the dengue treatment. And then once the fluid deficit is corrected, and then you change the amount of fluids that, and then gradually when the patient symptomatically improves, which takes about 3 to 4 to 5 days of time, generally, almost in every cases, and the patient goes home, and that's it. But the problem is not the dengue, but problem is the fear around the dengue. I think that is the major issues, and we must know that the dengue mortality is not really very high. Dengue mortality is not very high. Severe dengue happens very, very rarely. Most dengue are extremely benign in its course. Most can be treated at home. Only a few where the patient cannot have enough fluids in, feels very unwell. They are and they have certain dangerous signs like the bleeding through the nose or bleeding from anywhere. These are the certain warning signs when they should be admitted and they require special attention. But in most situations, they actually can be handled at home, and in only those situations, which are also fairly large number, which are treated in the hospitals, they only come in the hospital so that they cannot take the intravenous fluid at home. That is the majority. 9 out of 10. And only 1 out of 10 it requires the intensive care treatment, which...
So very nicely said by Dr. Biswajit Ghoshdastidar. Coming to Dr. Pushpita Mandal, as you must not forget, malaria is very, very important vector-borne disease as well. And many of us do have malaria in this season as well. So what are the high-risk group? What is the incubation period? And what are the clinical manifestations of uncomplicated malaria?
Yes, Saptarshi, your question is very pertinent to the malaria itself. Like Dr. Biswajit Ghoshdastidar was telling us how dengue is affecting mainly the tropical climates, and like that, malaria is also an endemic disease which is mostly vector-borne disease, and it is transmitted from one person to another person by the bite of the infected mosquito, which is called as Anopheles mosquito. And what they do whenever the person is suffering from malaria, whenever the mosquito bites that individual who is suffering from that, malaria parasites gets inoculated into the mosquito. And inside the mosquito, it keeps on breeding, and ultimately whenever this infected mosquito bites some another individual, the sporozoites which is there inside the mosquito is infiltrated into the human being, and this within a matter of say around 1-2 hours gets deposited into the liver of the infected individual. From there the malaria parasite starts on breeding, and ultimately from the liver they again goes into the circulation and infects the RBC, that is red blood cells, where inside the RBC also that parasite keeps on growing. Ultimately the RBC is ruptured with the merozoite form of the malarial parasite which releases, and this kind of circulation of this malarial parasite causes the febrile episodes, febrile paroxysm and all. So there are 2-3 varieties of malaria which we are aware of in these endemic areas, and almost more than 6 lakh deaths we can tell is happening because of malaria itself all over the world. And there are different varieties, like it could be because of Plasmodium vivax, which is very commonly seen nowadays, and other than this we have Plasmodium malariae, Plasmodium ovale, and the cerebral kind of malaria that is called as falciparum malaria. Previously we used to say that it is only falciparum malaria which causes very severe malaria, but nowadays whatever we are seeing in our day-to-day OPD practice as well as in our intensive care, that Plasmodium vivax infection is also becoming as severe as that of the falciparum malaria, where the patient initially actually whenever your malaria patient is coming, when we will suspect the patient is suffering from malaria, certain also severe body weight, high-grade fever, chills and malaise. It is all prevalent in uncomplicated malaria. But whenever the patient is coming to us in a later stage, that time it involves, because the malarial parasite grows very fast inside the human system, it causes the involvement of different organs. Like if presentation is late, then patient may become little confused. That means the patient is developing some signs of encephalopathy. that we called it as a cerebral malaria. Sometimes malaria, like what sir was telling, that dengue itself causes some increased viscosity of the blood vessels, for which blood is not able to be carried to different vital organs. That's why the different vital organs are affected. Like in the dengue, in malaria also, different organs are affected because the malarial parasite, the showers of malarial parasite causes occlusion of the microcirculations. Like if it affects the lung, then it causes lung involvement, decreased saturation level, decreased oxygenation. When it affects the liver, it causes jaundice. The parasite itself clogs the microcirculation. It may so happen that it affects the kidney also. Patient passes black colored urine, that is called black water fever. These are all signs of severe malaria. In uncomplicated malaria, we usually see fever is coming and going, patient is feeling weak, malaise, some sorts of dehydration. But when we have to be very aware, very conscious when we are seeing the patient is going into some stages of organ involvement in the form of either lung involvement or CNS involvement or hepatic involvement or kidney involvement. And sometimes it so happens that patient, because the malarial parasite has eating up all the blood sugars of your body, your patient may become suddenly unconscious. That time when we check the blood sugar level, we see that patient's blood glucose has gone down very low. That means severe malaria. One indication of severe malaria is patient becomes hypoglycemic. If we see the arterial blood gas level, which we do in our ICU patients, we see patient may be having severe acidosis because of the early involvement of the kidney. So these are the parameters which we always judge to know whether we are dealing with a patient with uncomplicated malaria or patient is moving towards a case of severe malaria.
So very nicely explained by Dr. Pushpita. My last question to Dr. Nirmalya Roychowdhury: what is the relevance of public knowledge in this vector-borne disease, and what is the prevention in general?
Regarding the public knowledge, I would say the most important things, as Dr. Ghoshdastidar and Dr. Mandal also pointed out, are being aware of the symptoms, because the diseases that we are discussing today, those vector-borne diseases, the common ones in India would be dengue, malaria, chikungunya, but one very important one to remember is the one that stands out, that is malaria, because malaria is the only one which has a specific treatment. That is, you can use anti-malarials for whatever kind of malaria you are suffering from. So being aware of the symptoms, at least to some extent, should be in the common public knowledge domain. That is, fever, in case of dengue, as sir mentioned, is called breath-borne fever, very severe joint pains. The joint pains and bone pain is even more severe in case of chikungunya. These are being aware of the symptoms, and when you are having any fever, when these diseases are common, particularly after the rainy season or during the rainy season, no one should take any fever lightly, and we should check for dengue, malaria, these common ones. And one very important thing, and which is particularly important in case of vector-borne diseases, is control of the vector, in these cases which is mosquito. And that is something doctors can't do, that is something people have to do. That is preventing any water logging. For instance, dengue virus is spread by Aedes aegypti mosquito. And where do these mosquitoes breed? They breed in fresh water which collects in some container, which may be something totally benign looking, something absolutely, no one would suspect to be of any harm. For instance, someone has a flower pot in somewhere on his balcony, or someone has some kind of container going unnoticed in the garden where rainwater can collect, and these kind of mosquitoes can breed there. So we as public need to be aware of these places where mosquitoes can grow and prevent those waterloggings, prevent collection of water in those vessels, in those containers, so that its number of mosquitoes can be controlled. For instance, if it is very common in any area to have dengue, then I would recommend using mosquito nets or mosquito repellents. Even if you are going outdoor, if you are going out for a walk, use mosquito repellent creams. So these are things we need to be aware of and public need to be aware of, so that we prevent mosquito bites, we prevent mosquito proliferations. Only then vector-borne diseases where mosquito is the vector can be controlled.
So
Thank you so
very
much.
nicely said by Dr. Nirmalya Roychowdhury. It's not only the awareness that is important, it is the role of the public which is also very, very important. You have to prevent it as well. The doctors, the physicians will do their job. Similarly, you also have the responsibilities to play. Thank you very much, our esteemed panel. It was a pleasure discussing and hope you will all benefit from this discussion. Thank you so much.